Welcome to the UC Quits webinar, The 5 A's of Tobacco Cessation, presented by Dr. Linda Sarna. My name is Jennifer Mataquari with the Smoking Cessation Leadership Center at UCSF, and I'll be your moderator for today's webinar. This webinar is one in a series of 5 webinars designed to educate providers on tobacco cessation and health systems change. The UC Quits project aims to further reduce tobacco use and exposure, the leading cause of preventable death, by developing a UC tobacco cessation network and UC e-referral system with the California Smokers Helpline. Headed by Dr. Eliza Tong from UC Davis, this ambitious project involves all 5 of the University of California health science campuses to ensure that every smoker receives support at every encounter. This system-wide collaboration is a historic change in how healthcare providers can ensure that smokers can get help to quit smoking by using the electronic healthcare record. Learn more about the UC Quits program at www.ucquits.com and the California Smokers Helpline at www.nobus.org. Now I will introduce today's speaker. Dr. Linda Sarna is Acting Dean of the School of Nursing at the Lulu Wolf Hassenplug Endowed Chair in Nursing at the University of California at Los Angeles. Dr. Sarna is internationally recognized for her work with promoting nursing involvement in tobacco control and in oncology nursing research focused on quality of life and symptoms of patients with lung cancer. As the principal investigator for the Tobacco-Free Nurses Initiative, funded by the Robert Wood Johnson Foundation, she initiated first national program to help nurses quit smoking and to promote the role of nurses in tobacco control, inaugurating the award-winning TFN website at www.tobaccofreenurses.org. And now for Linda.
Thank you, Jennifer. I'm delighted to be part of the UC Quits team. And today I want to talk about changes in the way we treat tobacco dependence. Now, we've known for a long time about the evidence of the dangers of smoking, but we also know that there are effective ways to help patients quit. In fact, 70% of smokers want to quit, but too few clinicians are prepared to help them address this chronic illness of tobacco dependence. And let's face it, few of us receive this information as part of our educational programs. The purpose of this webcast is to provide clinicians evidence-based information about how to help smokers quit. Please note that smoking is not a lifestyle, a choice. It is a disease with a defined etiology of nicotine dependence and symptoms. The nicotine in tobacco is highly addictive, and quitting smoking is difficult. But the 2008 Treating Tobacco Use and Dependence Clinical Practice Guideline does provide us evidence for the most effective intervention. This can be summarized actually as the 5 A's of tobacco treatment. Ask about tobacco use, advise smokers to quit, assess their readiness to quit, assist with quit attempts, and arrange for follow-up care. Each of these components is a very important part of the comprehensive tobacco cessation counseling intervention, and I'm going to review them for you now. Why is it so hard to quit? Well, it is hard because tobacco dependence is actually a chronic brain disease that has both physiological and behavioral components. Smoking cessation interventions that address both will be the most effective. Prolonged tobacco use results in dependence, which is characterized as a physiologic dependence or an addiction to nicotine, as well as the behavioral habit of continually using tobacco. While medications can help with the addiction to nicotine, as discussed in another webcast, The behavioral component can also be treated with behavioral change programs, both group programs and the telephone quit line, the California Smokers Helpline, 1-800-NO-BUTS. Well, the first step, of course, is ask, and I have to say, as healthcare providers, we're getting better at this, but we do need to ask patients at every encounter if he or she uses tobacco. Tobacco smoke has the potential to interact with many medications, altering drug levels and efficacy of treatment, and patients who smoke and are hospitalized may be going through withdrawal symptoms. It's essential that clinicians ask about tobacco use, document it in the health record, and follow up. For example, you might ask, do you or does anyone in your household ever smoke or use any type of tobacco? This will capture not only tobacco smoking, but other forms of tobacco use as well. The question could be followed up with another statement. We like to ask our patients about tobacco use because it has the potential to interact with medications. Or we like to ask our patients about tobacco use because it contributes to many medical conditions. When asking about tobacco use, it's important to take a genuine and sensitive approach, conveying concern for your patient's well-being. A judgmental tone is not going to result in a good response. And it's important to remember that if a patient say they no longer smoke, you might want to follow up on a question about when they quit. In fact, they may have quit on their way to the hospital, so you would want that information. The next A is to advise. You do want to advise smokers to quit. It's one of the most important things that they can do to protect their health and the health of others. One model to use when advising patients is the 5 R's. First R, relevance. Make it relevant to the patient. Make sure they understand the link between your advice to quit smoking and their current health issue or their potential improvements. Remind them that they're going to save money when they stop smoking, the risks of smoking. Remind patients that smoking harms almost every organ in the body, as we just discussed. And rewards of quitting highlight both the immediate and the long-term benefits. There are roadblocks that people will encounter, and you might want to remind people because it will be difficult to quit, and if they anticipate these, it will be even more helpful. And repetition, repetition, repetition. It's very important to repeat this advice as often as necessary. The next A is assess. You want to have an assessment of how eager patients are in terms of their quit efforts. As I mentioned previously, the majority of smokers do want to quit, so please remember that. But not everybody is at the same level. Many people have had experience in the past when they've made quit efforts, and you might want to review that. If they're willing to quit, you can provide some resources and assistance. But if say they're not interested in quitting right now, you might want to ask them, do you ever plan to quit, or how will it benefit you to quit later as opposed to now, and what's the worst thing that could happen if you were to quit tomorrow? And frankly, some of your patients may share with you that they've made quit efforts in the past and that it hasn't worked out. They feel like failures, and you can provide the framework and the support for them to understand that this is part of the normal quitting process, and that often people need a number of quit efforts before they're able to be successful. The next A is assist, and this is where you can help. You can assist tobacco users with the quit plan. Now, in an outpatient setting, ideally you can help people set a date. Within 2 weeks, you can get support from family and friends. You can review past quit attempts. You can anticipate challenges. However, you need to remember that patients who are entering a hospital may be not expecting that they're going to be in a quit attempt, but they're going to be a smoke-free environment, and we have to make certain that they have the support that they need if they're going to be experiencing nicotine withdrawal. In fact, it may be an opportunity that they can see that they can go tobacco-free for a period of time, and this might bode well for their quit attempts after they leave the hospital. You might want to, again, talk with the patients about the reasons for quitting, why they want to quit. Maybe they're going to redecorate their home and they don't want it to smell like smoke anymore. The benefits of quitting. They may have particular health issues, or they may want to be a role model for their children. You want to give advice on successful quitting, and some of this means that complete abstinence, that's right, not smoking even a single cigarette, is important, because just a puff will deliver nicotine and will lead to an increased risk of relapse. Drinking alcohol is strongly associated with relapse, so that you may want to have a discussion about how they're going to address this during the quitting period. Having other smokers in the household also hinders successful quitting, and this might be an opportunity to engage the entire family in making a quit effort. Most importantly, you want to encourage use of approved medications, because these will help limit the withdrawal symptoms. And again, in another webcast, you're going to be reviewing both the over-the-counter medications such as the nicotine patch, gum, or lozenge, or the prescriptions such as varenicline, bupropion, the nicotine inhaler, or the nasal spray. Please note that electronic cigarettes contain nicotine, but they are not approved for smoking cessation. Arrange for follow-up. If I had to identify 1A that's the very most important, it's this one, because relapse occurs after a quit attempt. You want to make certain that you encourage repeat quit efforts. If people do have a slip, tell them that relapse is part of the quitting process. You want to review with them what happened that caused this relapse, and use it as part of the learning experience. You want to reassess some of the medications that they've used. Sometimes people aren't using it appropriately in plans for termination. Please provide information about follow-up visits with the healthcare provider, and refer to other resources, and including the quit line. Again, having a plan for follow-up is extraordinarily important, and this is where after discharge the quit line can make such a difference. Ask, advise, refer. Well, this is another approach to using an evidence-based intervention where you're still going to ask about tobacco use, advise the tobacco users to quit, but due to time or limited expertise, you might want to refer them to other resources, particularly for our UC Quits efforts, the California Smokers Helpline. Why refer? Well, the California Smokers Helpline can also assist the patient with that careful assessment of the number of factors influencing their smoking and quit efforts, provide them with an ongoing support through communications over the telephone, and again, go beyond that quit effort in the hospital. And again, this is very, very important. So in summary, we've covered a lot of information. We've covered the 5 A's, which are a quick and effective way to address tobacco use with your patients, asking about tobacco use, advising patients to quit, assessing their willingness to quit, assisting them with a quit effort, and most importantly, arranging for follow-up. Even brief tobacco dependence treatment is effective, and every single patient who smokes or uses tobacco should be offered an intervention. You can do it. I know you can. Thank you.
Thank you, Dr. Linda Sarner, for your presentation on the 5 A's of tobacco cessation. Free CME and CEUs of up to 0.25 credits will be available for those who complete this online activity. The webinar link and instructions to claim credit will be posted on the UC Quits and the CME California websites. For questions on the UC Quits project, please contact Dr. Eliza Tong at the email address on the screen. Thank you very much for your time.